I'm Eranna. I'll cover first three chapters. So this first three chapters, it you will not have any much what is that like complicated terms and even process also. So if anybody is aware about anybody is from full NABH hospitals are like aware about this full NABH with addition standards implementation. Otherwise, any hospital, if even entry level or like even not accredited hospital also, if they have like a basic level information system in that hospital, for them, these three chapters, it will be like very simple chapters. So not that much complicated. So we'll see like, it is just like if you see this entire chapters, the only difference you will feel just only difference is when we implement other this other NABH standards, all things will be there, but there we don't use the word like it should be done digitally. Means you will have an option of you can implement the standards, but the option of implementing standard that objective creation or like implementation, it is up to you, to the client, means like to the hospital. They have option whether they can go with the hard copies or like digital copies and all. But here in this entire digital standards, every objective element, whatever it is mentioned, here there is no option actually. So here only everything will be the same, but you are going to implement it is you're going to implement all these things digitally. Except that word, you will not feel anything new in this first three chapters. Other chapters you will have a little bit technical words, but first three chapters it is a common one. Okay. Now, if you see AAC, you have totally 8 standards, and in this you have a core 3 objective elements, commitment 18 objective elements, and achievement 13 objective elements. Excellence 6. Totally, you will have 40 objective elements. So first we will see the AAC requirements. This is overall details of the total standards. So first one is first one is related to the display boards, educating the patients or clients related. So here, if you see, the hospital uses digital system to display general information, share education or informative materials with the public and patients. So here, this objective element is telling the hospitals to use the digital platforms. Like as I said, like every hospital they'll have a website like in their hospital name. So this kind of hospital website or any like hospital mobile apps can be used. We have to use it for the communicating the information to the public, to the patients or like to the public. Okay, if you see like many hospital website, inside the hospital website, so all these informations will be there. Like mainly we'll have a hospital scope of service, what services we are providing, and who are the doctors available, and who are the full time, who are the part time, what is the timings. Okay, and this hospital address, and few hospitals actually they'll provide some medical information, some educate you or like some preventive healthcare related materials they'll provide. So all this information now, instead of giving pamphlets or keeping the standees and mentioning on the display boards and all, now hospitals has to use the complete only digital systems for this communication purpose. So that is this objective elements. And same way here also, if you see, the hospital uses digital system to display their accreditation. So now again, if you see the many, if you see the regular hospital website, so apart from their regular their information, what they wanted to tell, communicate or tell to the patients or community, many hospitals they'll display somewhere out in the website only like their accreditations, like if it is ISO, NABH, NABH, JC, and so they'll display it. So now that is another requirement here. So hospitals has to display their accreditation through this digital platform. So that is another requirement. Then next one is the hospital uses digital means to send informative notifications. Now, if you wanted to communicate anything to the patients, now hospitals has to use some digital platforms like WhatsApp systems, from the WhatsApp or this SMS system or email, something like information notification. Something like if you wanted to tell if somebody has booked the appointment, like if you wanted to remind them like tomorrow is their appointment timing with so and so doctor, so they can come at that time. And again, if you wanted to tell like there any appointments are rescheduled, that we need to communicate for the communication purpose. We need to use the digital platform. That platform you can use it any platform you can use it for the communicating or alerting the patients. Then hospital uses digital displays to assist the patients inside the health. And again, here, what is this tells me? Now, patients will come to the hospital. So once they come to the hospital, inside also for them, like to guide them if they want where they wanted to go, like what are the services available, like communication purpose inside. So for that purpose also, we need to use the digital systems. Just some common digital systems which will be used for this communication means like in the reception counter, the token systems. Like if you register, like when is our consultation, like what is our number, like we'll wait it, and once our number comes, we'll go to the consultation room, no? And that kind of thing. Then again, like ways guiding one, and departmental names. So this kind of inside the communication, so inside information providing to the patients or public, it should be done by again digital systems. Then hospital uses at least one digital system for the patient registration. And again, this is a regular registration. So now there is no option of usually the creation of this UHID can be done even manually with the registration manual also. Like how we will give daily open numbers manually for small clinics. But here now it is like, as I said, there is no option. Now everything is digitalization. So this is again patient registration to be done any one of the method. Here actually the option is you can use it any digital system to implement this. So either through the kiosk, like keeping or just in the corridor area, like patients themselves they can register it. Otherwise, from your HMIS mobile apps or QR scans for this like ABDM related. So again, it should be done digitally. Then again, the hospital uses digital system to generate unique hospital identification for every new patient. Again, it is like same regular one for every registered patient. We have to generate one UHID, and this UHID at present it can be generated either with the help of with this Ayushman Bharat health account number is not mandatory to create this UHID at present. Then hospital uses digital system that has the capability to generate and capture the ABHA of patients and link it to unique patient's identification number. Now here the hospital's registration system or HMIS system which is used there, it should have a capability of one creation of this ABHA number if any patient doesn't have this ABHA number. Second, if ABHA number is there, we should be able to link that ABHA number with our UHID. So these two options should be there for our hospital HMIS system. Then hospital uses digital system that can identify duplicates entries. Now here again, our registration system should be able to tell if we enter any names double times, like if any unique details of the patient while registration, if anything is double time or like any details are duplicated by if we are entering this double time means it should be able to alert for us like this is already there type. That kind of system should be there. Then the hospital uses digital system that supports creation of patients records in an offline mode. See now here it is again it is like breakdown management type. So now if there is a registration system in the hospital or any system, so usually all these things will work only when there is a power. All these things are there. But if there is any your maintenance schedule is there, like during that time there is some planned maintenance is there, if there is any breakdown in the systems or anything is there, during that time like the softwares or like these apps or modules which will, these things will not work. So that kind of things it is very difficult to manage it. So what we should have is there should be some like option like this all modules, whatever modules are there, this module should be able to work offline also if there is no power or breakdown. And again when it is again when it comes to the online when we come to online, then again it should be able to synchronize and run again as a normal mode. So this backup system also should be there for our HMI system what we use in the hospital. Then hospital uses digital system that has the capability to create different transaction number for every repeat patient visit. Now here previously we saw UHID for the one. Then apart from that UHI unique identification number, for every visit we should generate our HMI system should be able to generate the transaction ID. And again this transaction ID should be linked to the UHID to ensure continuity. Then hospital uses digital system that has a capability to link all patients' medical records to unique patient identification. Now again, inside wherever hospital touch points, like when patient goes to the like after coming here for each transaction, if they come, if they go to the pharmacy, if they go to the lab, if they go to the radiology, so whatever information generated that should be able to link to the main UHID. Then hospital uses a digital system that has a capability to provide access of their patients' medical records to other hospital entities facilities. Now here, what is the requirement is like now it is like a digital medical record system. So now from our hospital, if I'm sending my patient to other hospitals, during that time again I should be able to share the patient all the data or information digitally. So for that there is a app a module called like master patient index. It is what is the master patient index means? It is the kind of our medical record room arranging in the digital mode. So here like we will keep all the patients records with that UHID. So now this accessibility we have to give it to the referral hospitals or like blood bank or laboratory where we wanted to access it. That person, that people, they can access that records digitally from our source. So that kind of system should be there. Then hospital uses digital system for booking an appointment by the patient. Again, there should be appointment system digitally. Again, it can be done by the hospital website or it can be done by any mobile app. Then hospital uses digital system that is interoperable with the external digital systems to capture and manage online patients' appointments using UHI. See now here again, see there are some applications, some players, companies who will provide this appointment system. So now in that scenario, for if my for my hospital like appointments, this appointment booking system is provided by some other means, some other like a company or like app means. Now whatever appointments are booked by that app should be able to come to me and it should alert me and I should be able to see and accept that and arrange according to that. So actually this kind of things will be done by using the United Health Interface. So this United Health Interface is the platform where it will give the accessibility of all the people. Accessibility like one person can access to the another one. So now here this third party apps related appointment should be linked to the my hospital HMIS. So whatever appointments are booked by that app should come to me and notify instantly, and I should be able to see and confirm the appointment and do accordingly. Then hospital uses digital system for patients and hospital to view the treating medical. And again, this system should be able to, while booking the appointment, patients should be able to see the doctor's profile. So the doctor's profile also should be made available on that. Then again, hospital uses digital system for patients to book an appointment for a specific. Now again here in that appointment system should be able to give an option of selecting the specific specialty doctor whom I wanted. Then hospital uses digital system for operating medical practitioners and healthcare professionals to view their appointment sheet. And apart now here, the option of giving to the patients booking, apart from this, even the healthcare professionals, doctors also should be able to see who and all book the appointment for them, so that accordingly they will adjust their timetable for that day. Then hospital uses digital mechanism to inform and notify patients about their upcoming follow-up. As I said, starting like this is the notification system. So all these appointments or cancellations or changings, all these things should be done digitally to inform them. Then the hospital uses system to generate unique sample identification for every sample. This is related to the lab. So now here from the lab for every sample, we have to generate one ID. And this lab ID should be able to, we should be able to link this lab ID to the main hospital UHID. Then hospital uses digital systems to track the movement of the laboratory. And again, by this using this lab ID or like QR code, we should be able to track the sample, the pathway of the sample, we should be able to track it, and we should be able to like calculate the turnaround time for this sample. The hospital uses digital system to auto-populate the laboratory results by integrating laboratory analysis. Yeah, there are few machines in the laboratory which will complete the automatically generate the reports. So now, if that kind of machines are there means we should be able to link that machines to our lab this LMS system, so that reports will get once automatically this reports will get generated. Then hospital uses digital system for the patients to access their laboratory reports. Now here, say now this reports what are generated automatically and sent to this HMIS, and from there again they should be again a linking system directly that reports can be seen by the patient. So here again, either we can create some like accessibility in our hospital website, a portal to the patient, so they can see directly, they can log in into that and see the patient. Otherwise, we should be able to send from any mobile apps this report. That means digitally we have to send the reports to the patients. Then hospitals uses digital systems to maintain records of all outsourced laboratory. Again, same here. Outsourced even laboratory tests also should be digitally. That means like the sending information, what we are sending to the outsourced samples, what time we are sending, and when we are receiving report, and again the reports making available to the patient. All things to be done digitally. Then again, hospital uses digital system to link the patient's lab reports to their ABHA accounts as part of their longitudinal. Again, apart from giving accessibility, like sending this report to the patient, we have to link this reports. We have to send this reports to the patient's ABHA account also. So again, this ABHA account, once patients create this ABHA account, again there will be personal health record address will be there. So we can, our HMI system should be able to send directly report and store in their account. Again, this is related to the laboratory, the same replication to the lab. So hospital uses digital system for the radiology department to create, finalize, and issue the reports. Again, here we should have this either PACS or RIS system where we will do the scan and we'll generate the report, and we will be able to issue these reports digitally either to the patients or to other healthcare professionals or hospital. It should be done digitally. So PACS or RIS is there, by default we will do this. And hospital uses digital system for the patients to have access to their radiology report. Again, once we generate the report, we should be able to send this report to the patient digitally, either from the giving accessibility in the hospital website as a portal or like from mobile app. Then hospital uses digital systems to maintain records of all outs. Again, same like lab, sending patients to outsourced scan centers, what time we are sending, who is taking the patient, and again what time we are receiving the reports, and again making these reports available to the patient should be done digitally. Then again, this is related to the admission management. So all this admission information, like starting, like if you see the inpatient or medical record front paper will be there when patient got admitted, what is the UHID, what is that, whether paid patient or like that admission form paper will be there. That should be made available digitally. Then again, hospital uses digital systems to assign patients to ward. Again, it is bed management. Like once that form is filled, automatically we'll allocate. Will allocate the patient like particular bed number, like bed number 5, bed number 10. That should be done digitally. It is a regular module. Then hospital uses system through which the primary treating medical practitioner can request update their patient. This is related to discharge system. So here actually the doctor should be able to put his discharge note digitally on that patient record. Then again, once he puts this digital request for advice for the discharge, this should again get by default alert to the all people who are involved in that, either ward nurse or like billing people or like any laboratory in any radiology who are and all involved in that this cross functional people. Everybody should get alert that that particular doctor has put the discharge advice. Then again, here after that, hospital is a digital system for the, and again like this receiving end departments also, they should have the digital system where they can do their work and clear that patient for the discharge. Example, like if billing department is there, means these people should be able to access all other whatever treatment is provided to them, where related to the payment, to check it and clear it. And again, they should clear it like digitally, so that that bed will be vacant for the next patient. Then the hospital is a digital system through the which the treating medical practitioner is able to generate patient discharge. Now again here, so apart from this putting the patient discharge advice, doctor should be able to pull this from their from this EHR, from all this like contents that he can just pull it and make it. Should be able to make the discharge summary and give it. Hospital uses digital system to manage interdepartmental patient transfer. And again here, if we send the patient to the one department to other department, the transfer summary should be able to give through the digital system. Hospital system, and again this is the related to the feedback. So again here, it should be done digitally. Either we can keep some kiosks in front of our reception area, so patients can fill directly there in that. Otherwise, we can send an email after their discharge or after their consultation. So again, there should be some digital system for this feedback also. Yeah. Then again, the information what we are collecting from this, it should be analyzed segment wise. Like if you have 10 departments, means 10 departments or 10 areas, like which area we have complaint and take the analysis. So that should be able to, we should be able to do digitally. So as I told, see this first chapter, all basic things only, nothing new. This is like regularly what we are doing. Most of it is like, as I told, like if it is even minimum basic IT system, or like if it is a fifth edition, any full NABH hospital, by default, all these things will be there. Then next one is the COP chapter. And here also everything just, it is just only to be done in the digital system. That's it. So first one is the OPD initial assessment and patient progress is recorded and a digital by the nurse. So here, see, nursing initial assessments should be documented digitally. Okay, that is the main requirement. You use the mobile, you use the tab, or you use anything like as in the introduction we told, like you just tell the voice instructions which will generate the this assessment sheet. Something you can use it, but it should be done digitally. So actually in the fifth edition or like any other edition, OPD nursing assessment is not there. I think here is the first time we are seeing. Then hospital uses digital system for treating medical practitioner to create OPD prescriptions and so again this is the OPD model for the doctors. So prescription and consultation should be able to, they should be able to do on the digital this OPD model. Then again, hospital uses digital systems to capture digital signatures of the treating medical practitioners. Actually, if the doctors are having the module, if they have a separate unique their ID and password, by default it is like signing, means you don't require a separate sign here. Then hospital uses digital system for treating medical practitioner to create computerized provider. This is CPOE related to the laboratory. So we should have a module where the clinician, the doctor, should be able to give the request, give the order or request for the laboratory test digitally. Actually, till the time you would have heard this word only for the medication, but now everything, whatever we do, that should be done. So that is why this computerized provider order entry, now it is must for the laboratory orders also. Then again, this is must for even for the radiology related also. If any consultant wanted to ask the patient to get any this radiology investigation to be done, again that should be ordered digitally only. And here this is again last this another CPOE is related to the medicine. Again, there should be one element in that our HMIS electronic medical record where doctor can give the medication orders digitally. Then again, hospital uses digital systems mechanisms to notify treating medical practitioners while placing a new request for their patients to duplicate laboratory. And again, here, see, if again, like starting like while doing registration, if I enter duplicate, it should alert. Same way, again here, for consultants or doctors, if they're doing any duplicate medications like double entries or double form request for the lab or radiology, that system should be able to alert the doctor that this is a duplicated one. Then again, the hospital uses digital system for patients to access their prescriptions. And again, like how we will lab reports and radiology reports, we are able to make it online and digitally available to the patient. Prescriptions also should be, we should be able to give through digitally, either again create a portal in the website or through the mobile apps or like online pharmacies related things. Then again, hospital uses digital system for creating medical practitioners to access patient medical records within the hospital. And again, here, this is like if doctor wanted to put any notes, like how if it is a hard copies means they will do from the treasure cards, no, like requesting and taking. Same way, there should be a system in this digital like where doctors can access and modify them if they wanted to modify or write or put some notes. That accessibility should be there. Then again, hospital uses digital system to link the patient record to his ABHA account, which then be accessed by the patient. And again, hospital digital system should have an option of linking this patient medical records to the ABHA account. Then hospital uses digital systems to access patients' past medical records and again, hospital HMS system should have an option, capability of accessing the patient's records from his ABHA account. One, we should be able to link our records to the ABHA account. Second, we should be able to access from that ABHA account. All options should be there for our HMI. Hospital uses digital system for the clinical risk. Again, here, we should have some questionnaire tools or something system where we should be able to identify the high risk patients like fall risk, DVT, pressure ulcer, and manage the patient digital. And again, hospital uses digital system for the nurses to create inpatient nursing record. Nursing initial assessment, reassessment should be done digitally. Then again, nursing care plan should be done digitally. Hospital uses digital system for the register and screen prospective. Again, if any patients comes for the blood bank, their details collection and registration and screening, everything should be done digitally. And again, in these scenarios, if there is any high risk patient like any HIV or any type of high risk, that kind of details if we get means we should be able to tag that means alert that patient so that next time if it comes means we will know that whether we can take that patient that donor blood or not, or like if anybody wanted to use also they'll get alerts. Hospital uses digital system to register and manage the blood bank comp. And again, entire blood bank stock should be managed digitally, like how much stock is there and when we are receiving request, when we are dispensing all these things. Inventory management completely digital. Hospital uses digital systems to capture blood transfusion register records. Everything should be captured, recorded digitally. Then again, this through this UHIs. Again, that stock inventory what we have in our blood bank should be able to access by all other departments or outside people, so that if they want one, they can request. Hospital uses digital system for the patients in emergency department. Again, like lab, like emergency patients registration in the emergency to be, if they come, registration to be done digitally. Then again, if the patients are MLC, again that information collection and tagging patient as a MLC to be done digitally. Then again, if there is any treatment is done to the patient during the transmit, means in the ambulance. So from there, the information should be able to come directly to the emergency department through digitally, like if like any wearable monitoring of the patient vitals through any wearable this devices, that kind of thing. There should be some system where whatever we are providing treatment or like monitoring the patient, that should be able to come directly to the emergency department, so that the information will be used to treat the patient efficiently. Then again, surgical safety checklist. Again, it should be digitally. So all the stickings and all this implementation to be done digitally. Then again, hospital uses digital system to capture pre-operative assessment, means doctor, physician, means surgeons, physician pre-operative assessment, and instructions like fasting, that kind of things to be what and all to be followed. That should be done digitally. And again, pre-anesthesia checkup and plan deciding and documentation to be done digitally. Then again, OT scheduling, OT schedule management to be done, like what case we are posting and what is the timing, that should be done digitally. And again, operation starting time and ending time, we have to capture it digitally, like incision time and closing time. Then hospital uses digital system to record such and such entire surgery notes to be recorded digitally by the surgeon. Then hospital uses digital system to record dietary consultation. Again, for all the patients, dietary assessments and diet plan to be done digitally. Digitally means like it should be done from this electronic medical record. Then again, the hospital uses digital system to track, report, and manage different types of infections related to the incidents. This is again in HA surveillance, daily monitoring of the patient who what kind daily surveillance, like our ICNs, their rounds they will do for this HA incidents related. So that entire information, who is getting infection, like what is the infection, what time it is reported, okay, all these details to be recorded digitally now. And there should be some apart from this recording, and there should be some system where we should be able to monitor the patient vitals and other patient conditions or data, so that we can we can guess that this patient is going to get, I think this patient is getting infection or got the infection, otherwise this patient infection is becoming severe. So this kind of system also should be there in our this medical record system.
10 minutes more, Eranna.
Yeah. Then hospital uses digital system for refer antibiotic usage policy. And again here our entire antibiotics, no, like selection of like now, see, based on the patient condition or indications, the antibiotic selection and how many days to be done and what is the route, all the things also automatically should be digital. So if I select like if this patient is getting particular infection, means automatically we should be able to select it from digitally, like this antibiotic, so indications are this, so we will go for this antibiotics and for this duration. So that entire thing should be automatic and digitalization. Then hospital uses a digital system to capture all patient care incidents and sentinel event, and it is incident reporting system. So now instead of writing all our like say this incident happened and this all the things and manually, now this entire incident reporting system, including the sentinel events, to be done digital through the digital man, and even analysis and making availability of that reports to the all involved departments to be done digitally. Then again, hospital uses digital systems to maintain records of the hospital stuff. Hospital, if anybody is getting exposed to the this needlistic injuries and things, so who exposed, and their PEP treatment related, complete treatment related tracking and all, everything to be recorded in the digitally. Then this non-hospital environment, if any hospital choose to provide this kind of as a scope, this virtual ICUs, EICUs, or like remote ICUs, this kind of things means they can go for this. They can use any of this digital platforms and offer, and even the treatment related whatever to monitor it. If any this digital tools are there, and that like during ambulance timing, how the transmission will be done. So same way here also we can use it and leverage any digital tool where it will make more efficient this communication and data sharing between the remote and here. And this is not mandated, like hospitals has to offer this virtual ICUs or all this telemedicine, and that it is an option. If anybody wanted to offer it, this not hospital environment, they can go. If not, they can exclude this. And this is same like this is also same like for home care treatment. If anybody as a part of their services scope, if they wanted to manage this home care, so they should be like bookings doing digitally, and again billing doing digitally. Then again monitoring can be done the patients again by using all these digital platforms and like this wearable devices or anything. Then again the information we should be able to track from the hospital what is happening here and all. So that kind of things, entire this management of home care to be done digital. Okay. Then again, rehabilitation services, assessments and reassessment, we have to record it digitally by including all these functional scales inside this electronic medical record. And again, we have to include this rehabilitation pathways in the electronic medical record to ensure that the treatments are provided according to this. So again, if you see the COP chapter also, everything is same, only just we have to do it in digitally. Now we'll see the MOM. Here we have very less. Okay, now hospital uses digital systems to manage inventory and disposal of medicines and consumables. Again, here the entire hospital means like pharmacy inventory to be managed by the digital. Means like if you take the pharmacy model, automatically all these things will be there inside. Like all this our like what is the stock, what is the expiry dates, and where the stocks is available. All this management should be done digitally. Then hospital uses digital systems to manage usage records of high risk medication. And again here, see here if there is any high risk medication, so actually our system should be able to tag that one. Like how manually, if it is like high risk means we will tag with the red or any like high risk label, no? That kind of things. Even digital also we should be able to tag that with some color. Red is okay. Then again, the prescribing person, the doctor should be able to know this is a high risk medication, and the receiving person, pharmacist also should be able to know that that is a high risk medication. Then again, formulary. So again, this formulary we have to make available to all the doctors digitally, either from mobile apps or from the computer. They should be able to see it digitally. This formulary. Then hospital uses digital systems to record the dispensing. Again, all dispensings, as I said, if we have pharmacy modules, dispensing to be will be default recorded digitally. So this dispensing details should be recorded digitally. Then hospital uses digital systems to identify, notify, and record the disposal of expiry medicine. Again, if you have that inventory system digitally, you should be able to track all these are what are the medicines which are going to get expired within 3 months or as per hospital policy. And even like if any clinician or like while writing, it should be able to pop up like say this is expiry medicine or near expiry medicine. And again, while dispensing time also, it should get pop up like to that people, pharmacy people, like whether it is near expiry or expired. So that kind of option or like mechanism should be there in HMA as well, sub modules. The hospital uses digital systems to record any return and recall of Again, recalls, returns should be done, recorded. All this process to be done digitally. Hospital uses digital systems to verify patient at the bedside before medicines administration. And again, we have to ensure that patient is correct. So now, usually manual means we'll ask like patient name, all these things. No? Now there should be some electronic mechanism like QR codes or like something. We will verify if the patient is the correct patient. Hospital uses digital systems to record the drug administration, and again, whatever drugs admitted, that should be entered all the status in the electronic medical record by the staff who are administering. The hospital uses digital systems to maintain records of all implantable processes and medical devices used in the care delivery. Again, there should be some tracker label for all the implants for the implant. And again, this implants what we have used should be digitally uh, linked to the patient medical record. That means operation notes and in the discharge summary. Hospital uses digital systems to prepare records for any medication errors, and again, incident reporting type like any medication errors to be reported digitally. Hospital uses digital systems to maintain records of the emergency medications along with the records of the stock. Okay. Now this is related to the emergency medication management. So in our in our inventory management, so we should have a module of system of all the emergency stock of emergency medicines. Where are the locations these medicines are available, and what is this reorder level for that particular location? So that option we should be able to see and manage digitally, and daily we should be able to check the stock levels, and again if there is any drug is used, then again we should be able to identify like this drug is used and it should be replaced. This kind of system should be made available digitally for this crash cart medicines or emergency medicines. Okay, I hope I have covered these three chapters. See, these three chapters implementation, it is the same like interpretation is same like our regular interpretation or interpretation like dictation or any other standards where it is mentioned. But the thing is, the records what we are going to create or show as an objective, like this is implemented. That records you will use any of digital mechanisms, electronic things to ensure this is digitally implemented. And from the ABDM or like from the NABH or anybody, there is no restrictions what digital things you can use it. As I told, you can use even like wearable devices, like you can use the electronic watch which can monitor your vitals and directly transmit to the electronic medical record what we are using it. Or like if you speak any device that like while like when you have a team like now when you do the multidisciplinary rounds, like you have all the doctors when they speak their conversation where automatically to get into the as a node. So again, as I said, like remote purpose, like if, remote ICUs or telemedicine is there, means there again you can use it any. There is no restriction that what item, what device or like app or like this platform you'll use it, but it should be done digitally. That is the main implementation of this entire thing. Other than that, these three chapters are no difficult things. I hope you understood. If there is any doubt, you can ask end of the session.
Thank you. Thank you, Eranna.